Alright bro, welcome back to the channel. It's been like what, months since I last posted. That was because I slacked off a lot and I said to myself that I had posted enough about calisthenics. Well, fun fact, it isn't enough. The content was dog shit. So I want to start by going through this book. I borrowed it from my cousin, Trail Guide to the Body. She's really expert in this stuff, everything about the body, massages. She knows a shit ton about strength conditioning, nutrition. So this will be a huge help to sort of getting better at calisthenics and strength overall, which is what we want to achieve in this channel. So we'll start by going to the first chapter, maybe first chapter, whatever you want to call it. And I'm going to start by reviewing the regions of the body. So let's take the sticker off. You guys can see it's a very funny little two images. We're going to go through them very quickly. I'm going to show you a tip to memorize these areas quickly and easily. And actually memorizing this will be useful for you because you know, the bones and muscles and all that stuff is highly related to the names of these regions. Everything is interconnected. I also wanted to mention that whatever I'm going to say here in these videos is going to be useful. I'm not going to tell you anything that's not useful for you, and not anything that's not useful for you to, I don't know, sort of learn. So let's get straight into it. So you can see like there are many areas of the body, and one quick way I use to memorize all this like quickly and easily is to divide it by sections. So you first start with the frontal part, and only you start by the head, then the shoulders, then the arm, and so on. So it first starts with the facial, the mandibular, supraclavicular, which is this part on the clavicle. Then you have the pectoral, axillary, brachial, and antecubital. I usually forget this name, but something that really helps me remember it is starting with the word ant. So I know that this part is cubital, this part is antecubital, and it's easier to sort of make your brain recall the word cubital if you start it with a word that you're kind of familiar with. So I start with I go to brachial, then if I don't remember this part, I try to start with this one first. So I say ant, and in no time the word comes out of my head. So antecubital, cubital, carpal, dorsal, digital. Then we go over to the body. I'm not sure if I'm going to be able to show everything, but we go to the inguinal, pubic, femoral, patellar. It's going to be some fun stretching here. Crural. Then you have you probably can't see that, but I'm going to show with the book. You have the dorsal, which is like the superior part of your foot. Imagine this is my foot, this is the dorsal part, this is the plantar. This will be very useful in no time, you'll see. And then we go over to the back side. So we finished the front side, everything's done. Oh, and I forgot the palmar part. So you have antecubital, cubital, palmar, carpal, dorsal, digital. That's the correct order. And then you go over to the back side, which we saw with the cranial, cervical, and then I like to do this sort of gesture that makes me easily remember that this part, like this, we call it group, is the cephalic part. So this is the cephalic region. Then we do the same trick. You just go all over down the body until you reach the feet. So then we have the acromial, which are the shoulders. We have the scapular, which is a funny scapular bone you have. Then we have the thoracic. So your spine has 4 to 5 divisions, 33 total bones, so 33 total segments of the spine. You have 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 to 5, this can, I think it can kind of vary, 4 to 5 coccyx. So 33 in total, divided by 5 regions. So in case you're wondering what's this cervical, thoracic, lumbar, sacral, and the other region is not mentioned here, that's all about the spine, so it's easier to remember. So you go over the cervical, acromial, scapular, thoracic, lumbar, sacral, pelvic, which is the pelvis, like bone. Then we go to the gluteal, which is your ass, your funny ass. Then we go over to the popliteal. You're gonna have to re-say to yourself his name a couple of times until you sort of get the hang of it. Just repeat the word popliteal, and you associate it with the back of your knee. And then you have the sural. So you have the crural part and the sural. Crural is on the front of the leg, so on the front of the shin. Crural. You have the sural. And that's it for the regions of the body. Now, this is important. Let's go to the planes of movement. You guys can see here. This is no big deal. You just gotta remember that the sagittal, there are 3 planes. Sagittal, the frontal, yeah, that's how you spell it, and transverse. So sagittal, frontal, transverse. The sagittal you can like sort of visualize as a, I'm not praying, but as a sort of line that goes like this throughout your body. So it's, the plane goes like this, and you can visualize, you can sort of x-ray your body like to the sides. So this is what I want you to imagine to easily recall the correct plane. So the sagittal is along this axis, I don't know if that's what you call it, and it slides through your bodies. Now there are 2 types of movements that occur in this place, in this plane. Is flexion and extension. So flexion is when you bring your bones together, and that's flexion, and extension is when you move them apart, so when you open the joint. And it makes sense. So let's go to the, oh, I needed to show you the anatomical position, I forgot about that. This is the anatomical position. So you have your palms facing outward, so your thumbs are like sort of sticking out like this. This is the anatomical position, and this is important because when we're talking about planes, like it's better to be on the anatomical position for things to make sense. So when you're on the anatomical position, when you flex your elbow, like the bones come together. It's not like it's on the sagittal plane, so you can observe the changes, like the changes in angles and position of the bones in this plane, not on the other. If you were to observe this on the frontal plane, you're probably going to be able to notice much of a difference, because the frontal plane is, it's like instead of being a line like this, it's a line like this. It's parallel to where you're facing, so it goes like this. You can imagine an X-ray going through your body from back to front. That's an easy way to recall it. So the frontal plane comes and goes like this. And I wanted to show you an example. Try to imagine you're observing a person in the sagittal plane. So the sagittal plane for you would be like this. Let me see if the camera gets this, otherwise it's going to be, what do you call it? Very, very funny. So when you're on the sagittal plane, you can very well observe the differences. So the bones are coming apart, coming together, and they're coming apart here. So that's why it's called flexion and extension. Whereas in the frontal plane, you wouldn't be able to really notice the difference, right? It's more on the lateral plane, so the sagittal plane, that you see the difference. This is the importance of knowing the right terms according to the right planes. In frontal plane, it's not flexion or extension, it's adduction and abduction. So you can think of adduction with 2 D's as adding, so they come close to your body. Adduction is coming close, and abduction is moving apart, so moving away from your body. And this can be seen on the frontal plane, because say I'm doing abduction, I'm moving apart. Look, you can very well see the difference here. And if I do adduction, your arms are coming close to my body. So this is abduction of my shoulder, abduction of my shoulder. And let me show you the example again. If I try to show you the abduction or abduction on the sagittal plane, you probably won't see much of a difference. Like it's very hard to sort of, not hard, but it doesn't. It's almost as you're seeing a 2D image here. Imagine a 2D image doing like this. It's like you just see an image of a person like flapping, right? Whereas if you see a 2D image perpendicular to this axis, it's much more clear the I would say the type of movement that's occurring, right? So this is abduction, this is abduction, this is flexion, this is extension. Whatever comes close to your body is flexion in the sagittal plane. Whatever goes apart is extension. Whatever goes close to your body in the frontal plane is adduction. Whatever goes apart is abduction. And you have the transverse plane, which isn't much of a big deal. It's like you're watching your body from the top. You can also imagine an X-ray here going through your body, so it is on this plane. And on this plane only occurs rotation. So rotation of the spine, internal rotation of the shoulder, like the shoulder is rotating. And there are a few other exceptions which you will see in just a bit. So with this we have the directions and positions. So now that we know the planes of movement, before we get into the directions and positions, I wanted to let you know that according to these planes, there are a few terms used to be able to localize or to localize muscles or like structures in your body. So when we're talking about a sagittal plane, right, we use the terms medial, that's close to the body, and lateral, that's further away from the body. So when we're here, medial is my nose, lateral is my ear, according to each other. So my nose is medial to the ear is lateral to the nose, because the nose is closer to the center of the sagittal plane. This is the same for the frontal plane, but except it is with anterior and posterior terms. So you ever like noticed how people on the gym fitness community talk about the anterior and the posterior parts of the shoulder? That's because the anterior part is more like on this chain of the body, it's on the front part of the body, whereas the posterior is on the back. So that's one easy way to recall your sorry about that. So the anterior chain is the front part, the posterior chain is the back part. So let's see an example here. The book gives us an example. This is all pretty easy to remember. You just gotta like be able to visualize. So you can see the sternum, which is this funny little bone in the front part of your ribs, because it's kind of wide, and the spine. According to each other, the sternum is anterior to the spine, and the spine is posterior to the sternum. These are all very simple terms. Once again, you just gotta be able to visualize. And in the transverse plane, they don't really talk about specific terms about localizing muscles and structures in your body. So let's go straight into the directions and positions section of the book. So when you're looking at the sagittal plane, remember we were looking at a X-ray of the side, right? On this plane, we're looking to the sides. We can see that the shoulder is superior to the knees, and the knees are inferior to the shoulder. The superior and inferior terms refer to structures that are either closer to the head or to the feet. So superior is logically and intuitively closer to the head, and inferior is closer to the feet. Now there are a few more, I would say, specificities, whatever you call it. Now there are a few more, I would say, terms besides the main ones, which are superior, inferior, anterior, posterior, and medial, lateral, that people like to use, that were invented actually because they were invented actually, and I have no idea why, but they were invented to specify terms in the trunk or in the limbs. So in the trunk we have the terms cranial and caudal. So this is the same as superior and inferior, except it's for the trunk stuff. So cranial is closer to the cranium, and caudal is closer to, I don't know, whatever you want to know, whatever you want to name it, but I'll just name it feet. So caudal is further away from the cranium, the cranial is closer to the head. So you can see here, the clavicle is closer to the cranium, so it will be cranial in relation to the umbilicus, and the umbilicus is caudal in relation to the clavicle. So the umbilicus is caudal to the clavicle. I already showed you the posterior and the anterior terms for locating body structures. I already showed you the medial and lateral. Proximal and distal refers to the limbs, so your legs, your arms. So let's say that I put my arm out like this, in the anatomical position, of course. Whatever's closer to the body is called proximal. Whatever's further away from the body is called distal. So the elbow here is proximal to the wrists. The wrists are distal to the elbow. Let me show you an example with the knee. I'm gonna jump over my bed. So the knee is proximal to the ankle. The ankle is distal to the knee. Get it? Proximal is closer, distal is further. Awesome. You got it, I hope. Now there are two more terms for the frontal plane of the body, which are superficial and deep. This is intuitive. So you're looking at the frontal plane, right? I'm just gonna turn my body around, but remember, this is the frontal plane. We're looking at my body like X-ray in this plane. So let's say I grab my pectoralis major, right, the muscle here, and I have my ribs here, which are underneath. In this case, the pectoralis major, which is the chest muscle, is superficial to the ribs, whereas the ribs are deep to the chest muscle. You can see the example here. So the pectoralis major, you can better visualize it, is superficial to the ribs. The ribs are deep to the pectoralis major. It's all very intuitive. You don't need to stress about this. You just need to be able to visualize and like easily, not easily, but be able to recall everything and intuitively get there. So now that I've explained all of this to you, everything that I'm going to show you now is going to make much more sense. So let's take a look at the movements of the body section. So you have, as you can see here in the book, it starts talking about extension, flexion, adduction, abduction, medial rotation, lateral rotation. So it all becomes very simple when you understand the things that I just explained now. So let's take a look at the sagittal plane, right? We're looking at the anatomical position, which is like this. So if I flex my fingers, they're coming together. This is flexion, right? This is flexion, this is extension. Coming together, coming apart. Flexion, extension. Let's look at adduction and abduction, right? Let's say I'm abducting my hip, and now I'm adducting my hip. I'm bringing together, moving apart. Bringing together, moving apart. This is in the frontal plane. It all makes sense, alright? It's much easier to understand. Let's take a look at the lateral and medial rotation of the shoulder. So, medial rotation is when you bring, this is in the transverse plane, remember. So, medial is when you bring to the body, lateral is when you bring it away from the body, when you take it away from the body. So, medial rotation, internal rotation of the shoulder. Lateral rotation, external rotation of the shoulder. You're bringing apart. Remember, it's very simple. You have also the rotation of the spine, which has no specific, specific lateral or medial terms to describe into which direction it's coming, because it's universal, I guess. And you have a few other terms which you need to know, like very specific. So here is shoulder circumduction. So circumduction is when it goes, so when you can move a joint along all planes of movement. So this is circumduction. It's like flexion, extension, adduction, abduction, and horizontal adduction, horizontal abduction. So it's doing something like this. You can also do this with your hip. I'm going to show you. This is circumduction. Remember, I'm making immense gymnastics for you to remember. That is hip circumduction, or hip. Yeah, I think that is hip circumduction. Is it? Yeah. You have the term lateral flexion, which is for your neck. So when you're lying, this is lateral flexion. This is one of those, I would say, this is one of those exceptional cases where, like, even though you're looking at the frontal plane, it's not adduction or abduction, it's lateral flexion. Because, yeah, I can't justify this to you, but just know that it's lateral flexion for the neck. This is also true for your spine and stuff. So lateral flexion, medial rotation, lateral rotation, internal rotation, external rotation, flexion, extension, adduction, abduction. Remember, it's very easy. You have a few other movements such as the, let me take my shirt off. Time to show that I'm jacked. So you have the elevation of the scapula, depression of the scapula. How am I going to do this with the mandible? You have the elevation of the mandible, depression of the mandible. You have another specific term, which is supination of the forearm. This is very easy for calisthenics people because, you know, we use the term supination and pronation. You have the supination and pronation. So imagine you're doing a supinated planche, right, with your arms like this. This is supination, and this is pronation. So when you're, what do you call this? This part of the hand is facing up, pronation, supination when the palm tries to face up. This is easily demonstrated with a door handle example. So you can see the guy trying to open the door, supination, pronation, closing the door. So now that you know the terms supination and pronation, this should make sense to you. So lying in a supine position, so facing up, and lying in a prone position when you're faced against the bed or whatever surface you're lying into. You also have the terms inversion and aversion, right? These are very funny for your feet. There's no. Yeah, should have known. Yeah, I hit with my head up there. So this is inversion. This is aversion. Inversion, aversion. So inversion. So one easy way to remember this is try to imagine inversion going in. So in, right? In. Inversion, in. Whereas aversion is like going out. Going out like this. Like inversion, eversion, aversion. Eversion, aversion. Inversion, aversion. It's very easy to remember. You just gotta like ding, 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 ding. And what was that? You just gotta like, what? You just gotta keep like, you just gotta visualize and constantly recall it. You have the plantar flexion and dorsiflexion. So, plantar flexion, remember the body regions of the body that I told you. This is the, let me see if you can see it. This is the dorsal, this is the plantar region of your body. So, dorsiflexion is when you flex, is when you try to bring your feet closer to the shin. And plantar flexion is when you step on the gas. So remember the sagittal plane, the types of movement, flexion and extension. In the feet, it's not the same. It's plantar flexion and dorsiflexion. So dorsiflexion, you're flexing with the upper part of your foot. Plantar flexion is when you step on the gas. This is very easily demonstrated here. You also have protraction, retraction of your jaw. You have the deviation, which goes to the sides. You have the opposition. So with the it's with the pinky. It's very, very easy. You have all of these stuff, which is very easy to know, and you don't even need to remember. It's just logical sense. It's very easy to know because you know the planes. So when you're looking in the sagittal plane, let's say I do this with my back, you know it's flexion because I'm bringing like the spine closer to my body. Whereas if I do extension, it's like almost as if the joints just open up, right? You have the rotation of the spine, you have lateral flexion, right? This is the one exception you should remember. You have the lateral flexion of the neck as well. It's the same for the spine, the same for the neck. You have the rotation, you have the flexion, extension, and you have another exception here, which are the ribs or the thorax. So when we inhale, this is inhalation, which is called elevation or expansion, and when we exhale, this is called depression or collapse. So inhalation, elevation, expansion, exhalation, depression, collapse. Remember this. Repeat these movements and repeat these words to yourself. This is a trick that I use to very easily remember stuff. So sometimes I'm on the living room studying, I'm just like touching my body around, like for example with the regions of the body, like remembering it. I'm just walking around doing like this, regurgitating the words to myself, and people probably think you will be a schizophrenic person doing this, but trust me, it's a very good tip to remember everything. So whenever you feel like studying or whenever you need to remember something, just do the movement and associate a word with it, and it will be much easier to recall it if you just imitate that movement later on. So if I do this 10 times, inhalation, elevation, expansion, depression, collapse, exhalation, depression, collapse. If I do this 10 times, my brain will sort of associate inhalation with the words inhalation, elevation, expansion, and the same for any other movement that you're trying to do with your body. So let's say you have an exam and you need to remember this. If you had practiced this before, if you just by doing this, your brain will almost automatically remember the words associated with that movement pattern. So it will say inhalation, elevation, expansion. That's a very good trick that I use to remember everything and whenever I need to. So now moving on to the scapula, you have a few different types of movements. One of them is elevation, depression. You have the retraction, which is adduction, and you have adduction, which is protraction. You can imagine some dude hitting a punching bag. Sorry, I was forgetting the word. Adduction, abduction, elevation, depression. You have also upward and downward rotation. So this is upward. Sorry, I'm very terrible at doing this. You have upward rotation and downward rotation on the right side. So upward rotation, downward rotation, upward rotation, downward rotation of the scapula. I don't know if I performed these movements right, but just know that. Hold on, I'm gonna show you the image. It's much better to see it like this. So now with the shoulder, remember the planes. This is sagittal plane, so we're talking about flexion, extension, flexion, extension. Remember this plane. Now we have frontal plane, right? Adduction, abduction, adduction, abduction. Now we have the transverse plane, so rotation. We have medial rotation, lateral rotation, medial rotation, lateral rotation, internal rotation, external rotation. And for the shoulder, we have one more additional type of movement, which may be a little bit confusing, but I will try to show you with a little visualization trick, which is the horizontal adduction and abduction. So remember, this is adduction and this is abduction, right? Moving away from the body, moving closer to the body. This is horizontal adduction, it's coming close to the body, and this is horizontal abduction. Now, why is it called horizontal adduction or abductions? So, imagine, this is the humerus, right? The bone in your arm. And this is the sort of the socket in which the shoulder like rotates, right? So, if I do this, this is abduction, and this is abduction. Adduction, abduction, right? If I do this, this is flexion, this is extension. So flexion, extension. And this is internal rotation, this is external rotation. So medial rotation, lateral rotation. So what happens if we mix the abduction with sort of the medial or lateral rotation? This is what we get. So if I do this, if I do like this, you would probably say that it's medial rotation, but in reality it's horizontal abduction, and this is horizontal abduction. Here's why. So remember, this is internal rotation, external rotation. This is abduction, this is adduction. So here's why it is horizontal abduction and abduction. So if we abduct with our shoulder and then we sort of internally rotate, it's not called internal rotation or medial rotation, it's called horizontal adduction. So we're bringing it close, because instead of rotating just like this or like this, your shoulder is like this, right? And then it comes closer to the body and it comes away from the body. So adduction and abduction. We have the wrist as well, so on the anatomical position, it's like this direction. Fuck! I keep doing a lot of fucking gymnastics here. So we have the wrist, which is flexion, extension, flexion, extension. The same is with your palm. So you have, remember, it's like this, the anatomical position. So you have adduction, abduction, adduction, abduction. So adduction coming, I'm showing here, adduction coming close to your body, abduction coming away from your body. It's all very easy once you know the basics of the planes. So you have also flexion, extension, flexion, extension, abduction, 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 on position. This is with your thumb. It's kind of weird, this one, but you just have to get really like intuitively guess this one. You'll have to sort of remember it. I also had kind of a hard time remembering, but whatever, I now know it. So we have sit with the fingers, flexion, extension, flexion, extension. You also have adduction, abduction, adduction, abduction. Coming close together, adduction, coming apart, abduction. So adduction is adding, so coming together. Abduction is just moving apart. Remember that, it all makes sense. Elevation, detraction, protraction, retraction, lateral deviation. It's with the mandible. Probably looked goofy as fuck doing that. The same with the pelvis. So remember the anterior and posterior terms. You have the, this is going to be fun. So you have the lateral tilt, which is how girls in high school try to show their ass. And you have posterior tilt, which is like anterior, posterior, anterior, posterior. You can better visualize this with the vectoral arrows you have in the book. And you also have lateral tilt, which is with the hip. Like this. This is so fucking goofy. So now let's look at the hip. It's the same thing. Flexion, extension, adduction, abduction, medial rotation, lateral rotation. Flexion, extension, adduction, coming together, abduction, coming apart. We have medial rotation, so you bring the knee into your body. Medial rotation, internal rotation of the hip. Lateral rotation, so external rotation of the hip. The knee can also rotate laterally and medially. You'll see why. So you have flexion, extensions. You have, look here, medial rotation, lateral rotation, medial rotation, lateral rotation. Remember, medial is internal, lateral is external. You have the same for the ankle, foot, and toes. So dorsiflexion, plantar flexion, dorsiflexion, plantar flexion. You have what is this? Flexion, extension of the toes. Flexion, extension. Remember, if you're ever having a hard time like classifying a type of movement, just try to visualize in which plane it is. So if it's on the sagittal plane that you notice the most difference, then it is flexion or extension. It's just a matter of seeing if the bones come closer together or come apart. You also have inversion of the foot and eversion. Inversion, eversion. So in the inversion, so on the inversion movement, your palm of the feet, the bottom part of the feet just come together. On inversion, just apart. Remember that. And holy shit, I'm fucking tired. That was it for the movements and stuff of part of the book. I hope you really understand that, because that was a massive workout for me. So I really hope that this video helps you out, and I guess I'll see you on the next chapter, which we will cover the skeletal system. So yeah, I'm going to show you how to memorize the skeleton. I'll see you next time.